Hi guys, Dr. B here. So we are going to finish up chapter 8 and we're going to focus on some genetic disorders and we are going to look at how they are inherited. That's what we're focusing on. The first disorder is sickle cell anemia. The type is autosomal recessive. That means that for somebody to inherit this, they need two recessive traits on their in the red blood cells, if you will. It is autosomal, meaning that it's inherited in all those cells that are not considered sex cells, or they're not. It's not related to the X chromosome, which is when we talk about sex like that. So what happens is that if you have this mutation, you produce defective hemoglobin. Hemoglobin is what carries oxygen in the blood. And if it's defective, you end up with sickle-shaped red blood cells, indicated with the arrows on the side. These red blood cells cannot carry oxygen well. They can cut off blood supply, meaning they can actually block blood flow, and in doing so, it can cause pain crises, meaning episodes of pain, severe pain, because blood is being cut off. That means oxygen is cut off, and if oxygen is cut off, that means that lactic acid is being built up, and that causes pain. Amputation. So if you don't have enough blood supply going to something like the finger, nose, ears, toes, you can actually it can amputate, meaning it will fall off because it has a lack of blood flow, lack of oxygen, and all that. However, if a person is heterozygous, so let's look at it this way. So if it's sickle cell, we'll call it, if they're recessive, they have to have SS for the alleles. However, if they're heterozygous, meaning capital S, lowercase s, this person will be then protected against malaria. And just for your own edification, they're not protected from they're not being protected from the infection, just the disease, just the symptoms that can show up if somebody has malaria, which we'll talk about on the next slide. So malaria is caused by Plasmodium. They are usually spread by Anopheles mosquitoes, females, and some of the symptoms are fever, tiredness, vomiting, and headache. That doesn't sound too bad, but now you'll get into yellow skin, which is called jaundice, seizures, coma, and death. So if somebody has a sickle cell trait, or meaning they're heterozygous for malaria, heterozygous for a sickle cell, then they are protected against the symptoms that you see with malaria. The next one is cystic fibrosis. So this is also another example of an autosomal recessive disorder. It is the most common fatal hereditary disorder among Caucasians, to the point that 1 in 25 have at least one copy recessive. So they have the recessive allele for having cystic fibrosis. So what happens is that you have a defective chloride ion transport protein. Essentially, chloride, sodium, all that. So chloride is actually allows you to help, you can say that it creates a situation where you're able to expel mucus correctly. However, if you cannot transport chloride ions correctly, you can get actually something called mucus plugs. And these clog up organs like lungs and pancreas. As you can see, look at this person's lungs over here, this person who has cystic fibrosis. They are often short of breath. They can have pneumonia frequently. And if you notice, since mucus plugs up the pancreas, therefore you can actually get diabetes, because the pancreas is part of the system that will help that helps regulate your blood sugar. And if your pancreas isn't working, well, then you can have diabetes with this. Another thing that I kind of like, that sounds horrible to say, but one of the things that is one of the key words, if you will, is they actually have something called, there's like a sweat when cystic fibrosis, when when it's a baby or a child. So they'll actually will test the sweat, and if they realize it's too salty or it tastes like sodium chloride, that means that there may be a problem with the baby may have cystic fibrosis. It's called a sweat test. This next disorder is hemophilia, and it is X-linked recessive. That means it is carried on the X chromosome. Poor guy. So what happens is that the blood is not able to clot properly. So you have easy bruising and easy bleeding. So maybe he tore something in his knee, like one of the ligaments by accident, or maybe he tripped or something, and he just can't stop bleeding. And this is called hemarthrosis. So heme, blood, arth right here, that's joint. So blood in the joint. That's exactly what that is. So hemophilia, hemo like blood, philia meaning love or like of. So that's kind of, it's like this person likes blood. No, they're not a vampire or anything like that, but that's what the term means. The next disorder is Huntington's disease. So it is an autosomal dominant one. What happens is that the brain tissue will just degenerate over time, and it starts around middle age. You have something called chorea, which is dance-like movements, mental illness, and early death. When we're in class, I'll show you a video of somebody with Huntington's disease. Rett Syndrome, it's a form of autism that typically affects girls only. It's X-linked dominant, so it's carried on the X chromosome. So some symptoms are mental retardation, slow growth, seizures, early dementia, and it starts around age 1, which is pretty sad. So usually what they will say is that, oh, my daughter she was born quote unquote normal. And then around age 1 or maybe 11 months, 13 months, we started knowing she's having some issues. Maybe she started having seizures, or maybe she stopped growing, all the type of stuff. And people would realize that, and they're like, we need to get this checked out. So they would get maybe a pedigree or do some genetic testing, and they would find this genetic mutation.